Welcome to AFSPA Talks, a production of the American Foreign Service Protective Association. Each month, we deliver informative health and wellness topics you want to know about, so make sure to subscribe to us on your preferred podcast platform. And if you have any questions about content discussed in this episode, ask them at AFSPA Live, our live Q&A session streaming every last Thursday of the month at 11 a.m. Eastern Time on youtube.com/AFSPA Cares. Now here's your host, Chief Executive Officer Kyle Longton.
Hi, and welcome to another episode of AFSPA Talks. I'm Kyle Longton, and with me as always is...
Maddie Norton.
Maddie, we are recording this on November 1st.
Yes, happy November.
Happy November. Spooky season is over, which means
is.
it's time for another season.
Open season.
Open season. Yes.
Finally
yes.
Here.
And so that's what we're doing today, AFSPA Talks Open Season. And we're excited to share a good bit of information for you. And it's just Maddie and me today talking through this. So we're going to try to get you as much information as possible. And while keeping it as short and sweet, get you the details that you need.
Exactly. And if you're wondering, what is open season? Open season is when you have the opportunity to change your healthcare insurance and it's only for a certain amount of time. So that's why it's important you listen, you get the details, and you figure out what you want to do. And so open season officially begins November 11th. And it'll last for 4 weeks until December 9th. And can you remind us what programs are part of open season?
Yeah, so you already mentioned the biggest one, which is health insurance. So for most people, that's the Federal Employee Health Benefits Program. I'm going to mention it's not relevant to I think most of our listeners, but there is going to be, starting in January, a launch of a Postal Service Health Benefits Program for Postal Service employees and annuitants and their families. They will have to enroll in plans under Postal Service. I don't think we have a lot of folks from the Postal Service who listen, and we're not going to talk about the Postal Service Health Benefits Program today. We're focused on federal employee health benefits. So your health insurance, that's a big one. The Federal Employee Dental and Vision Insurance Program. So your dental and vision insurance, one or the other or both. And then the Flexible Spending Account Program through FSA Feds. And like Maddie, like you said, it's this is the time of year when everybody can explore and make changes. I will say with FSA Feds, you do have to take action every year. So if you want to if you're enrolled this year, you want to be enrolled next year, you've got to go in and re-enroll. But with the health insurance and the dental and vision, if you like what you've got this year, you want the same thing next year, you don't have to do anything. It will automatically roll over.
Nice. And that is important, especially when it's holiday season too. So lots of things on people's minds. And so if you don't want to make a change, there you go. Speaking of changes, though, what are the big changes this year?
Yeah, well, that's a great question. So I'm going to start with the easier ones. FSA Feds, as of right now, as we're recording this on November 1st, there has not been an official announcement about any changes to the maximums for that program for 2025. So the latest information I saw, this can change mid-November, and if so, we'll incorporate that into updates to our members and on our website and so forth. But as of right now, members can elect a healthcare FSA up to $3,200, minimum election of $100. So you use that for your out-of-pocket medical expenses, even dental and vision, and certain over-the-counter items. And it's a tax program. It's a tax benefit program. It comes out of your paycheck pre-tax for active employees, so it lowers your taxable income. For the for the dependent care FSA, we don't anticipate any changes. That's usually a $5,000 limit per household, and there's that has not changed in a number of years. For the FedVIP program, the dental and vision insurance, so no, we don't anticipate any new carriers in there, no big changes in benefits this year. And for the dental program, premiums are going up on average about just shy of 3%. And for the vision program, on average, premiums are going up just shy of 1%, about 0.87% on average. So no big changes there. Again, if you like what you've got, you'll keep it. With the FEHB, I'll be honest, the Office of Personnel Management that oversees the entire health insurance program, actually all of these programs, didn't mandate a lot of changes this year. We're seeing sort of continuation, encouraging plans to improve coverage they have in certain areas, particularly around fertility and on the coverage for weight loss solutions. And we can talk more about that in a little bit. And we'll definitely cover that in our open season webinars. But not a lot of changes. A lot of what they're focused on has been launching the Postal Service Health Benefits Program. So FEHB plans do check, because as I've gone through different plans, they are making certain changes to various benefits, which is great, but it's not across the board. So you will not see like everybody's going to cover some new
Right.
service now. It's just everybody maybe tweaking their benefits here and there. Um, and so I would say just check your individual plans, see what changes are. Every plan in their brochure has section 2. This is their big brochure. Section 2 has bulleted list of all the changes that are occurring from the previous year to the new year.
Nice. So look out for section 2 in those brochures and make sure of all those changes.
Mhm.
All right. Now, tough topic. How do premiums look across the board?
Okay, so this one's a little more difficult. This is the highest average premium increase that I've seen since I've been working in this space for 12 years now. Um, uh, and it's been reported as at least the highest in the decade and so forth. But premiums on average are increasing 13.5% for FEHB plans. And there's a number of reasons why that's the case. Some of it has to do with just general inflation in the healthcare sector. Prices for office visits, for surgeries, for emergency room, all of it are going up.
Right.
And we've seen this. This is some catch up. We're also seeing people use the services more. This is
Mhm.
post-pandemic catch up, which is great. We want people to use healthcare. We want them to get preventive
Right.
care. We want them to get treatment, but it's not free. And prices just are again are generally going up. Um, we're also seeing, plans had to start in 2024 covering fertility services for the first time. Again, a huge step forward for the FEHB program to start covering these services, but we didn't have a real sense of how many people would use that or how far the
Right.
services would go. And so some of that's pushing on premiums upward. Also, certain prescription drugs, particularly the GLP-1s that can be used for diabetes and for weight loss.
Mhm.
Um, those are proving to be very popular, and they're very expensive, somewhere around $1,400 to $1,500 per month. And out-of-pocket costs for members are fairly low, but that means the plans are picking up more. And as we're seeing more
Right.
and more people use that, that is a factor that is pushing things up. And the last one, and I saw this in some information from OPM, mental health services. Again, this is fantastic. This is something that we wanted to do when we started this podcast, is sort of remove the stigma around getting mental health services, encourage people to take advantage of those services and support programs. And people are doing that. But again, it's not free.
Right.
And prices are going up there, and not a lot in certain areas, providers aren't necessarily a network, higher costs for everybody and so forth. So those are some of the main reasons we're seeing premiums go up in record. And I do want to emphasize that 13.5% is an average. I have seen some plans in the FEHB. HMOs usually sort of in single digits, even low single digits, 3-4% increases. And then other plans that are going up over 20%. Um,
Wow.
so that's something. This is a good year to take a look at what you've got.
Absolutely. Absolutely. Unfortunately, things do cost money. Seems to be the memo. All right. So let's talk about AFSPA. What will 2025 look like for foreign service benefit plan members?
Yeah, well, I am glad to report that we're keeping a lot of the very popular features that have brought people to the plan over time and have kept people enrolled in foreign service benefit plans. So the deductibles remaining the same at in-network $300 for self only, $600 for the self plus one or family enrollment. We're not changing anything around our cost share for members. So in-network services are still covered at 90%. Out of network, still an option. 70% of the plan allowance is covered by FSBP. We're still considering all overseas providers to be in network, so you'll get that higher reimbursement rate. And we accept whatever the overseas provider bills as the plan allowance. And I really want to emphasize this because I know there are some changes coming to other plans out there. And I don't know exactly, if they're lowering copays, waiving copays, how that interacts with their plan allowance. I can tell you for us, it has not changed. If you're in a high cost area overseas, your doctor bills more than would typically be the case in the United States, we're going to accept whatever that provider bills and reimburse based on our benefits. If it's inpatient or preventive care, 100%. If it's outpatient or professional services, et cetera, most services that we think of as healthcare, 90%, because we're considering that provider in network and 90% of what they bill. So no changes there. And I'm glad to report we're not making any changes on the alternative benefits.
Woo!
So yeah, I know members still have access to 50 massage therapy visits, 50 chiropractic visits, and 50 acupuncture visits. Every member under the plan has that, and we'll reimburse up to $75 per visit.
Absolutely. And that's one of our favorite parts of the plan.
Yes, that
Um,
that brings a lot of people in.
right, exactly. And then how about FSBP's premiums? What's the percent change there? How do they compare?
Yeah, so that's a good point. And you know what? I talked about what we're keeping the same with FSVP. I forgot to talk about what's changing for next year. So let me hit
You
that, and then I'll talk about premiums. I'm sorry. Um, we're making infertility services more accessible to members on artificial insemination. So there are no changes coming to in vitro fertilization, those advanced reproductive technology uh, services. So in particular, in vitro fertilization, GIFT, ZIF, ICSI, and if people are looking at these services, they'll know what all those mean.
right,
But all of those services that sort of are associated with IVF still require prior approval if you're overseas or in the US, wherever you are in the world, need to get prior approval. And if you're in the US, you still have to go to an Institutes of Excellence infertility provider for those services. However, if you're looking at artificial insemination, and the most common service these days for artificial insemination is intrauterine insemination, IUI. We're removing the requirement for prior approval there. We're also removing the requirement that you have to go to Institutes of Excellence infertility providers. So you can go to any in-network or out-of-network or overseas provider for artificial insemination services, and you don't have to get prior approval. So we're trying to make that a little bit more accessible, a little bit easier for people to seek those services when they feel the time is right. That's it.
nice.
And then for our overseas members, we're adding two programs. The first is a change. So we do have telehealth for our members overseas as well as stateside. Stateside, it's through Teledoc. Overseas, it's been through a partnership that we term V Health, also Teledoc Group overseas, but I'll refer to it as V Health. That's what's in our brochure. And V Health has offered both general medicine. That's going to continue. And we've been offering a mental health solution through V Health. That's actually going to change next year. So there'll no longer be mental health offered through V Health. We're going to switch the mental health offering for overseas members, just when you're overseas, to a group called Lyra Health. And we are making this change. We think that it may offer uh, care to more of our members, including teenagers. In many places, care begins at age 12 instead of at the age 18, and maybe longer term ongoing care. So we're going to try this out, see how it works. We welcome feedback from members, encourage members to use it. We're also launching a new preventive care coaching program. This will be through a partnership with V-Health. This is designed in particular for members who may be managing a chronic condition while they're living overseas. They may be getting care from a local doctor, and not sure, okay, what do the lab results mean? What does this imaging mean?
Right.
So forth. So it's not really a second opinion. It's a partnership for those ongoing care issues. This is not somebody you're going to talk to on a weekly or even monthly basis, but maybe when you have an appointment, you want to get some additional perspective, understand what some of the test results mean and so forth. This will be a doctor or a nurse who you'll connect with to talk you through sort of what the meaning of things are. So I encourage members to use that. These programs are free, the telehealth programs, and they're open to all members overseas.
Good.
So
Glad that we're expanding overseas healthcare over there.
yeah, we're doing our best. And we do have, I'll just mention this, we don't have all the details yet. We do have some changes coming for our members in Japan, and we'll have more information out to them as soon as we finalize the details for greater support for them and getting care for the Department of Defense civilians.
Nice. All
All
right.
right.
So back to the premiums.
Yep. Yep. I delayed long enough, right? No. So actually our premiums are going up right in line with the program average. So FSBP, the overall premiums are going up 13%. Members in self-only and family will see that the enrollee portion is going up 13%. I want to speak very carefully to the people who may be enrolled in Self Plus One. Self Plus One in 2024 already costs more for the enrollee than family. And this is the overall premiums are very close, and the overall premium actually Self Plus One is less than family. But when the government calculates its contribution, it actually contributes less to Self Plus One. And so we end up with family costing enrollees less than Self Plus One. So those who are in a two-party family, I really encourage you make the change from Self Plus One to family during open season. You will save more than $500 in 2025 because we're seeing a big increase to Self Plus One for next year. So please make that change. Take a look at the information we're sending you. In fact, if you're enrolled in Self Plus One, you should have received a letter and an email from me telling you to please make this change. But
Exactly.
I also want to highlight, even though we're going up right in line with the program average, take a look again, this is a year to compare. Take a look at what's out there, especially if you're considering FSVP, compare us to the plan you have, see what features are out there as well as the premium. We are very proud of what we offer, and we think that you'll like what we have to offer and what you'll find with FSVP.
Absolutely. And money's going, people are spending more money, but we do have a way for FSBP members to actually save money as well, right?
Yes, we do. There are a lot of options. Telehealth is one of those options because we do offer telehealth again stateside through our partnership with Teladoc, overseas through vHealth for general medicine consultations, and starting in 2025 through Lyra for mental health. That's available at no cost to members. And stateside, you can get general medicine treatment. The provider can actually call in a prescription, send a prescription to your local pharmacy when you're stateside. You can have ongoing mental health care, and actually, we've seen mental health visits outpace general medicine visits so far in 2024 through Teladoc. And there's also dermatology and nutrition services, and it's at no cost. And
Right.
there's no limit to the number of visits. So this is a great way for you to access care from your own home or wherever you're comfortable, or if you're on the go, and you don't have a provider locally. You oh, if you want in-person care, and sometimes that's the right move, you've got options for low cost care. You can go to a CVS Minute Clinic or Health Hub in the US, $0 copay. No
Nice.
copay for FSBP members. If that's not the right move for you, or maybe if there's another local walk-in convenient care clinic like the Little Clinic or Minute Clinic, some of those, um, if you I'm sorry, the Little Clinic that may be associated not with the CVS options, those are a $10 copay for whatever you may need, and there's usually a physician's assistant or nurse practitioner who's offering care in those settings. And if you need something more, you can go to urgent care. It's a $50 copay for urgent care. So these are all available. Usually you can get in to see someone faster there than maybe at the emergency room or waiting for an appointment with your doctor. And then we also offer a robust wellness program. So, Maddie, I've harped on this before. I'm going to do it again. We offer our members age 18 and older, everybody, enrollees, spouses, children age 18 and older, the opportunity to earn up to $400 per year in wellness incentives by doing a health risk assessment, getting your annual physical, age and stage appropriate cancer treatments, coaching, just tracking your activity and so forth. Last year, 2023, members had the opportunity to earn up to $29 million. They only earned $2 million.
No.
So, and that money goes, I know, that money goes into an account and we use it to cover out-of-pocket costs for members. We can't do more with it than that, but we can reimburse you for any out-of-pocket costs you have for care. And so I really encourage, it's not too late for 2024 to start earning these monies, and you can start again on January 1st, 2025 to start earning $400 again next year. So that can be a real help. That's your entire calendar year deductible and then some when you talk
Right.
about $400. So I encourage
Mhm.
people to take advantage of that.
Absolutely. And our favorite topic that we just did AFSPA Live on,
Medicare was a big topic last year.
Yeah.
What should our Medicare eligible members know for 2025?
Yeah. So, first of all, we heard from members,
We did.
and the Medicare, let me use the full name, the FSBP Express Scripts Medicare Prescription Drug Plan Employer Group Waiver Plan, that's EGWP, typically referred to by us as the PDP, the Prescription Drug Plan, has gone from auto enrollment to opt-in. So if members are interested in this, they must contact us. They can fill out a form on our website at afspa.org/PDP, Prescription Drug Plan, and they can opt in. And we've actually seen more people stick with this than I originally anticipated. And I think the reason is they're seeing savings.
Right.
And they'll see even greater savings in many cases in 2025 because some of the changes that are happening in Medicare Part D. If that's of interest to you, I encourage you go back and to our YouTube page and watch the
Right.
AFSPA live from October 31st. We went through the details there, but you may be saving money because of the way out-of-pocket costs are being calculated. We also have a Medicare Advantage a Medicare Advantage plan that includes a Part D plan, separate Part D plan, that we've seen about 600 or so members who've been enrolled in that consistently and seem to like it. And that's a savings opportunity, both for out-of-pocket costs, but with the Medicare Advantage plan, members actually get a reduction in their Part B premium of $75 per month. So you can actually save
Nice.
up to $900 a year on your Part B premiums there. So just some options for folks to consider and perhaps take advantage of. I'll also note with the PDP and the MAPD, you are not locked in for the calendar year. You can opt in at any point during the year. If it doesn't work for you, you can opt out. We have those in place. Usually that opt in or that opt out becomes effective at the beginning of the next calendar month.
Right. And those two plans specifically are not, you don't have a penalty if you were to opt in or opt out.
Correct for
Right.
us.
Yes.
There may be penalties if you're enrolling in Medicare Part B, as in boy,
Right.
late. But the Part D plan, had creditable coverage, no penalty for enrolling at that point. But yeah, we're not assessing anything that, oh, you should have done this years ago. No.
Right. Right. All right. Good to know. Um, and if anybody were thinking or are thinking of making changes, how do they do that?
Sure. So for the FEHB, I'm going to be very vague. You want to go through your HR office or your retirement office, depending on where you fall. And they'll issue information about their preferred method, whether you go through an online system or submit a paper form or scan a paper form, whatever it is. They'll issue that guidance probably if they haven't already done so in the next week or so before open season starts on the 11th. For the Federal Employee Dental and Vision Insurance Program, FedVIP, you want to go to benefeds.com, and we'll put the link in the show notes for that. That's
For sure.
benefeds.com. And for the flexible spending account program, that's fsafeds.com. Again, with the flexible spending account program, you've got to take action every single year.
Absolutely. Is there anything else people should be thinking about?
Oh, so November is actually nationally known as Long-Term Care Insurance Awareness Month. And we're not doing a lot of programming on that. There is the federal long-term care insurance program is still in a frozen state, is the best way to put it. It has been since December 2022. I think that was supposed to be for 24 months. We should probably see some sort of update before the end of the year. Maddie, we'll absolutely have a program on that
Right.
when more details are available to let people know what's going on. But I encourage people think about long-term care. Check out our website, and we've got information there about our long-term care partners who offer free consultations. And then we did a program on this at the end of September to get people ready, and we had to make some changes. So I don't think that's out there anymore. So I do want to encourage folks to know that we have an open enrollment period right now for our life insurance programs. For our group enhanced life, it's a guaranteed issue amount. That means you can get the amount if you're age 65 and under. You fill out the information. $50,000 guaranteed issue. You can apply for up to $600,000, but anything over that $50,000 or $50,000 increase on your existing coverage will be subject to what we call medical underwriting. So you'll just have to complete a short medical questionnaire about your health history and so forth. But that's available through December 1st, so 1 month left. That's open to anybody who's eligible for AFSPA membership. And then Also, we have an open enrollment period for our immediate benefit plan, also a term life plan, but that's only open to active employees in certain agencies, particularly the Department of State, a handful of other agencies, but really a Department of State, both Foreign Service and Civil Service. So folks should check that out on our website at afspa.org/life.
Nice. And if you're wondering where can I find more information, what else is going on during open season, do not worry. We have so much content coming for you. We are doing 11 webinars this open season. And by we, I mean Kyle is. And you can find all of those links and register for them at our website, afspa.org/events. I believe our first webinar is November 18th. So you have, a little more than 2 weeks to get registered for that. And they're going to be at all different times. 10 a.m., 10 p.m., 5 a.m. Don't you worry. We have a time for you, especially if you're overseas. So definitely make sure you look at those, because Kyle will be giving the entire open season presentation. And more importantly, well, not more importantly, but equally as important, we have AFSPA Live on November 21st. So right before Thanksgiving. And it will be entirely focused on open season. And we will be there to answer any questions you may have, especially before, Thanksgiving takes over. And we'll be able to answer questions there. And as well, we have some credential webinars coming up on November 12th at 3 different times. And that is going to be for planning your retirement in your 50s and 60s. So definitely check that out if that's something that interests you. And we also have our financial wellness checkups going on for then as well. And I think I've covered everything of what's coming up. But if I haven't, please stay tuned to our social media channels, because you will definitely be able to see what we're doing there. And if you want to learn more about open season, go to afspa.org/open season for more details.
That's great. And I want to reiterate that for all those webinars and for AFSPA Live, we want you to ask questions. Through the webinars, we'll have a live chat. I'll be there. It'll actually be, I think, a video of me giving the presentation so that I can focus on the chat and answer questions as we're going through. And AFSPA Live is a lot of fun. I think we'll have some of our colleagues join us who are going, like me, out to see members overseas.
Right.
So we'll have that feedback from members, their frequently asked questions, and a great jumping off place. So I look forward to engaging with many of you throughout open season and connecting again on November 21st, if not before.
Absolutely.
All right. For more information about open season, visit afspa.org/open season and see the links in the show notes for today's episode. This has been AFSPA Talks, a production of the American Foreign Service Protective Association. All information offered in this podcast is meant to be educational. The views expressed by the hosts and guests are their own and do not necessarily represent AFSPA. Should there be any discrepancy between information offered in this podcast and official plan documents for the Foreign Service Benefit Plan or the other products offered by AFSPA, the policy provisions will prevail. Thanks for listening, and be sure to follow or subscribe to AFSPA Talks to catch our next episode. Please rate and review us on your favorite podcast app and share feedback with us on Facebook, Instagram, or LinkedIn. Search for @AFSPA Cares. We'll talk again soon.
Thanks for listening to this episode of AFSPA Talks. Be sure to subscribe to our channel so you'll never miss an episode. If you have any follow-up questions about the topics in this episode, join our AFSPA Live Q&A session on the last Thursday of every month. We will be streaming live at 11 a.m. Eastern Time on our YouTube channel at youtube.com/AFSPA Cares. Thanks for listening.